Now to continue, we were drawing the structures passing through the jugular foramen, and we have already said that the jugular foramen is located somewhere here. This is the position of the jugular foramen, and on this side this is the position of the jugular foramen. If we just clear off one side, so this is the position of the jugular foramen over here, between the petrous part of the temporal bone and the condylar part of the occipital bone. And the structures passing through the jugular foramen, the medial most structure is the inferior petrosal sinus, the lateral most structure is the sigmoid sinus, which is continued below as the superior bulb of the internal jugular vein, and this inferior petrosal sinus is going to become the first tributary of that internal jugular vein. Apart from that, you have the three cranial nerves, the 9th, 10th and 11th cranial nerves, which are going to pass through the middle section of the jugular foramen. So the structures passing through the jugular foramen: inferior petrosal sinus, sigmoid sinus, 9th, 10th and 11th cranial nerves. So more or less this 11th cranial nerve is actually separate proximal to the jugular foramen, and it is separate distal to the jugular foramen. It's only while passing through the jugular foramen that you have a single intact accessory nerve. Proximal to that, the cranial and spinal roots are separate. Distal to that also, the cranial and spinal roots are separate. So you have gone through the structures passing through the jugular foramen as well. Now in the posterior cranial fossa, you are left with no significant structure. You have gone through one another thing we could mention though, because we are mentioning the margins of the jugular foramen. When you look at this posterior border of this petrous temporal bone over here, when you are coming to the margin of the jugular foramen, that is, I would say somewhere at this point. If you look at this margin of the petrous temporal bone, this margin of the petrous temporal bone, when it was coming like this, suddenly you have a small notch just below the internal auditory meatus. This posterior border of the petrous temporal, that is going like this, it gives a notch over there, and that notch, you can make out a small notch here, a little bit posterior to our position which we have declared. However, you have to look at it from close quarters to actually see the notch. Maybe the notch is this one. However, we won't go into those things, but there is a notch on the posterior border of the petrous temporal, and that notch, this notch that you can see, is meant for the Cochlea Canaliculus. So just as through the aqueduct of vestibule you have the endolymphatic sac and duct, through the Cochlea Canaliculus you have the protrusion of the cochlear duct. So from the internal ear, two prolongations are coming out of the petrous temporal. Over here, through the slit behind the subarcuate fossa, you have the endolymphatic sac and duct which protrudes, and over here through the notch that you have on the lower posterior border of the petrous temporal, you have the protrusion of the cochlear duct. So both the endolymphatic duct and the cochlear duct, they are protruding out of the petrous part of the temporal bone into the posterior cranial fossa. Not only that, in the depth of this notch you have a tunnel going deep inside and reaching the middle ear cavity, that is called the Cochlea Canaliculus, and that Cochlea Canaliculus transmits the tympanic branch of the glossopharyngeal nerve. Now that tympanic branch of the glossopharyngeal nerve enters the middle ear and it forms the tympanic plexus over the promontory, and you know that from that tympanic plexus you had the lesser superficial petrosal nerve coming, and that lesser superficial petrosal nerve, you know, was passing through the foramen ovale, just as you had a greater superficial petrosal nerve which was passing through the foramen lacerum. So you had a lesser superficial petrosal nerve passing through the foramen ovale. That lesser superficial petrosal nerve had come from the tympanic plexus on the promontory of the middle ear cavity, and that tympanic plexus is formed by the tympanic branch of that glossopharyngeal nerve, and that tympanic branch of glossopharyngeal nerve has entered the petrous part of the temporal through a notch on that posterior border of the petrous temporal, and through that same opening you have the protrusion of the cochlear duct, and that notch is called the Cochlea Canaliculus. So the whole thing appears to be quite complicated, and I would advise you to go through these videos more than once. There are a number of videos. They are quite complicated. They are not very simple. Keep your books out and go through them several times so that you can master the base of the skull. Thank you.